Our work really centers around serving the City of Victoria's most vulnerable, highest risk. We don't necessarily work in the area of low income or affordable housing. And the model that we've developed, called the Dual Model of Housing Care, is a supportive housing program. The Dual Model of Housing Care really came about after we piloted the Mayor's Priority Task Force. On the one column or pillar, it focuses on culturally supportive housing. That's elder support, auntie support, traditional foods, prayer, smudging, a real cultural connection. And the second column is decolonized harm reduction practice. We are of the belief that we have to first strengthen indigeneity, help to pass along traditional and indigenous skills, and with those skills, people get a sense of purpose, where they come from, who they are, and with that sense of purpose comes hope. What encompasses our work right from intake to helping to move people through the continuum of housing is that we are there to support their physical, emotional, mental, and spiritual health and wellness. Well, we went from 7 staff before COVID, and we have almost 90 now. Our success comes from the fact that we've been able to create a buffer and a circle of allies. And you can't do this work in isolation. The competency and compassion, passion, commitment, and drive of our team speaks volumes. Having key partners in the city willing to try new ways, willing to have some hard conversations, knowing that what we're trying to do is to influence policy change and to address structural barriers. And so that's what we're doing.
The work that's being done at the house, it's not just a physical thing, it's a spiritual thing as well, because we have ceremonies there. We do smudging ceremonies, reconnection to the land, and teaching about spirituality. We believe in working with them in every aspect of who they are and their. We do have the nurses and a doctor, and we have the counselor, and we have the cultural and spiritual workers and the elders that come in, and just spend time with the family members, supporting them and making sure that every part of them is being taken care of. They aren't homeless people to us, they're our family.
Someone who was on the streets since he was 15, and he said, for 31 years, this is when we first met him, and he said his friend was cardboard because it kept him off with the cold cement. And here we are, he's being housed now for a year. When we bring that touch of culture to them, it makes a big difference.
Pathways to healing and recovery. That is the foundation of our housing. That's where we're going. Because it's not enough to just give a house. If all we're doing is to recognize that people are in their addictions and chronic alcoholism, really then all we're doing is giving them a dry, safer place to die or overdose. That's not enough. We have to do more. And that's what we're trying to do. I don't think BC Nonprofit Housing Association knows what this means to us, and it just makes me want to cry, because it's just that validation I need for our hardworking team. Yeah, so thanks.